Hi everyone. In Typhoid Part 1, I talked mainly about the organism and its characteristics, whereas in this video, that is Part 2 of Typhoid, I will be mainly talking about the disease. Shall we see that? Let us talk about the disease. Enteric fever is caused by different serotypes, as I said before. The fever caused by Salmonella typhi is called typhoid, whereas the fever caused by Salmonella paratyphi A, B and C is called paratyphoid fever. Infection is usually by the ingestion of contaminated food and water. And the ID50, which is the infectious dose needed to infect 50% of the animals tested, is around 10 to the power of 3 to 10 to the power of 6 bacilli. The incubation period, that is, the time taken for the organism to cause the first set of symptoms after the entry of it inside the human body, is from 7 to 14 days. After the entry, the bacilli reach the gut region and attach themselves to the ileal mucosa and penetrate the lamina propria and submucosa. There, the bacilli will be phagocytosed by the two important immune cells, macrophages and neutrophils. But instead of getting killed by these immune cells, they start multiplying inside them and get carried to the mesenteric lymph nodes. And via the thoracic duct, they enter the bloodstream. This is transient bacteremia, and during this time, the bacilli will get seeded in the different vital organs of the body, that is, the liver, gallbladder, spleen, bone marrow, lungs, and kidneys. And in these organs, they further multiply, and at the end of the incubation period, there will be a massive bacteremia. This results in the onset of typical symptoms of typhoid. In the early stages of typhoid, the symptoms that are commonly observed are headache, malaise, anorexia, that is loss of appetite, and also coated tongue. As the disease proceeds, we will start seeing the typical symptoms of typhoid, that is step ladder pyrexia, which I will explain in the next slide, bradycardia, that is decreased heart rate, and also toxemia. You will see rose spots throughout the surface of the skin. In some patients, typhoid might result in serious complications like intestinal perforation, that is mainly due to the ulcers seen in the intestinal epithelium, circulatory collapse, that is low BP condition, bronchitis, that is inflammation of bronchi, cholecystitis, that is inflammation of gallbladder, arthritis, that is inflammation of joints, and nephritis, that is inflammation of kidney. The right side image in this slide explains the stepladder pyrexia condition. The temperature of the body will keep increasing day by day with intermediate plateaus reaching a peak of around 40 to 41 degrees Celsius or 104 to 105 degree Fahrenheit. The left side image shows the coated tongue condition of a typhoid patient. Talking about the epidemiology of typhoid, in advanced countries where proper sanitation facilities and treated water supply are available, typhoid is virtually eliminated. But it is endemic in all parts of India. Disease occurs at all ages, but more common in 5 to 20 years age group. The source of infection of this organism is the fecal material of either patient or carrier. Carrier is a person who has recovered from the disease but keeps shedding the bacilli in his fecal material. Three types of carriers are observed. The first one is convalescent carrier, who sheds the bacilli from 3 weeks to 3 months after the recovery. Temporary carrier is the one who sheds the bacilli for 3 months to less than a year. And the chronic carrier is a person who sheds the bacilli even after 1 year. The proportion of typhoid to paratyphoid A is 10:1. How to detect this organism in the laboratory? We usually follow two methods. The first one is the cultural method and the second one is the serological method. In cultural method, we are going to isolate the bacilli from either blood or fecal material. Here I have given the flowchart for isolating the organism from blood. For this, you have to first take 5 to 10 ml of blood from the patient and inoculate it in 50 to 100 ml of bile broth. This is to dilute any inhibitory substance that will be present in the blood. Incubate this bile broth overnight at 37 degrees Celsius. Then the next day, the broth will be subcultured in McConkey agar and again incubated at 37 degrees Celsius for 24 hours. If Salmonella infection is there, you will see non-lactose fermenting colonies, that is colorless colonies on McConkey agar. These colonies can further be identified by different biochemical tests and also by motility determination. The most common serological test that is done for detecting typhoid is Widal test, which is an agglutination reaction taking place between the Salmonella antigens H and O and the antibodies present in the serum. If a patient is suffering from typhoid, then in his blood there will be antibodies against the H and O antigens of the Salmonella species. So, demonstrating the presence of antibodies against these two antigens, that is H and O, in patient sera will confirm the Salmonella infection. The test can be done either on the slide or in the test tube. In the rapid slide test, we are going to take a drop of different antigens of Salmonella. That is O antigen and H antigen of Salmonella typhi, H antigen of Salmonella paratyphi A, H antigen of Salmonella paratyphi B, and also negative control and positive control. And to these circles, we are going to add a drop of patient sera and mix well. If the specific antibodies are present in the patient sera, then there will be visible clumping. This is an indication for positive result. Slide test can be done either as a qualitative test or as a semi-quantitative test. Quantitative tube test is usually done after we get positive result in the slide test. Here, different dilutions of antibodies, that is the patient's sera, will be taken in the test tubes, and then a fixed quantity of antigens will be added to all the test tubes and incubated. The highest dilution of the antibody, which shows agglutination, is the titer of the antibody present in the patient serum. The antibody titer of 1:100 for O agglutinins and 1:200 for H agglutinins are considered significant. Typhoid can be efficiently prevented by taking certain general measures and special measures. The general measures include improving the sanitation conditions, providing treated water supply, and also identifying and treating the carriers. The special measure is mainly by giving vaccines. 3 types of vaccines are available. The first one is the TAB vaccine, which is the vaccine introduced during the First World War. It is basically a killed vaccine in which it contains 10 to the power of 9 Salmonella typhi cells, 10 to the power of 7 Salmonella paratyphi A and B cells in 1 ml. It is usually given in 2 doses of 0.5 ml subcutaneously at an interval of 4 to 6 weeks. The second vaccine is the type 2-1A. This is a live oral vaccine. This is a mutant bacilli which, when introduced inside the body, initiate the infection but cannot cause the illness. One capsule of this vaccine has 10 to the power of 9 cells, and this capsule will be usually given on day 1, 3, 5 and 7. The third vaccine is the Typhim VI vaccine. I have talked about VI polysaccharide antigen before. So this antigen is extracted from Salmonella typhi and is given as a vaccine parenterally, that is either as a subcutaneous injection or intramuscular injection in a single dose. Until the 1970s, the drug of choice for treating typhoid infection was chloramphenicol. But in 1972, resistance to chloramphenicol was observed in Salmonella species. Later on, ampicillin, amoxicillin, cotrimoxazole and furazolidine were tried. But even for these drugs, resistance developed. Now, the drug of choice for multi-drug resistant cases include mainly fluoroquinolones like ciprofloxacin and ufloxacin, and also the third generation cephalosporin antibiotics like ceftriaxone and cefotoxime. Dear students, in this presentation, I have tried to give a comprehensive view on typhoid, about the organism and also about the disease. Hope it was useful to you. Please refer these books for further understanding the disease. Thank you and all the best.